Hi, Dr. Frank Johnson from Sport Medicine Ultrasound Canada. I'm going to show you how to scan the first extensor compartment of the wrist. It's a location where we get de Quervain's tenosynovitis. The patient position is supine with the thumb pointed up at the ceiling. So the skeleton model, we've got the wrist quite flexed just so the camera can see this a bit better. The landmark is going to be Lister's tubercle, which is this bony prominence on the dorsal radius. The orientation of the probe is going to be short axis or cross section on the distal forearm with Lister's tubercle in the center of the screen. The movements are then going to be coming around the corner towards the thumb and looking down at the radial most aspect of the radius. Now the area of interest is going to be the collagen tissue just sitting on top of the bone at this spot. And so this is how we scan the first extensor compartment of the wrist. I'm going to show you how to scan and inject the Quervain's tendonitis. I usually like to have my patients supine with the palm about like so, almost like holding a cup. Some practitioners would prefer to have their patients seated across from them. But either way, I normally like to start on Lister's tubercle, which we see on the screen here. And this whole length is the second extensor compartment. De Quervain's is the first extensor compartment, so we'll come around the corner and we're now on the first extensor compartment with the two tendons of the first extensor compartment being highlighted by the yellow arrow. My needle entry angle is going to be like so, and my needle will land superficial to the tendon and subcutaneous right where the needle tip is. There's an alternative way to find the first extensor compartment, and that's to start on the anterior aspect of the forearm by finding the radial artery. We can see it compressing just below the yellow arrow. And we can almost see the entire portion of the extensor compartment, the first extensor compartment, in the middle of the screen, whilst the radial artery is on the left-hand side of the screen. Once again, the angle of needle entry would be like so, and the needle would land right where that yellow arrow tip is. So those are two different methods to find and inject the first extensor compartment of the wrist.